you already know what biofilm is. Because biofilm is the preferred phenotype, which is the term that we use in microbiology, for all bacteria. 99% of bacteria in nature exist as a biofilm phenotype. However, over the past 150 years, we've studied them in a planktonic phenotype. And that's kind of driven some of our strategies from the standpoint of therapeutics, which address acute infection very well, but aren't necessarily appropriate for chronic infection. So biofilm, I said, you already knew what that is. That's the plaque on your teeth, scum on a toilet. It's the film that you see in your water fountain outside. That's how bacteria exist in nature. Their strategy, their primary goal is first to attach themselves to a surface, and then they change their gene regulation, upregulate specific genes, and express this slime, okay, that ultimately becomes this biofilm. So you already know it. You think about, God's a pretty smart guy. Your skin sloughs for a reason. The mucosa in your GI tract turns over rapidly for a reason. And the mucus in your lungs, unless you're a cystic fibrosis patient, turns over for a reason. And that reason is to prevent bacteria from attaching long-term to you and giving you a chronic state of bacterial load. So in wound care, if we're talking about wound care, once the host defense is broken, that's the skin. Now muscle, bone, and tendon do not turn over like that. They don't have those innate strategies to prevent that. So then bacteria can actually attach and form that same film when we talked about plaque on your teeth in that wound bed. And it also makes it an environment to become polymicrobial. In other words, other bacteria can come in that point. Any infection that's chronic is going to have that phenotype, biofilm phenotype, because that is the preferred phenotype for bacteria to exist in. As they mature in their development, they all head that direction.